Hello, good morning. I'm Nipuna. I'm a final year student of Department of Nursing in Allied Health Sciences, KDU. Today I'm going to present about a study regarding parents' awareness about leisure time physical activity of the children aged 9 years in Kesbewa Education Division, Sri Lanka. So I'm going to discuss about this specific area of our study: introduction, objectives, methodology, result, discussion, conclusion, and references. This is the introduction. What is the leisure time physical activity? You heard about that. As I think you heard about physical activities. According to the Kandul and Lauderdale in 2005, they define that physical activity performed during exercises, recreation, or any time other than that associated with one's regular occupation, housework, or transportation, and as primary exercise or sports related activities. And what are the benefits of LTPA? LTPA means leisure time physical activities. It's mainly promote health and fitness and builds healthy bones and muscles of the children, and it also reduces the risk of the developing obesity, risk factors for the disease such as diabetic and heart diseases, and reduce the symptoms of anxiety and depression. And why physical activities important for the school? There are a lot of importance. A main one is can positively affect concentration, memory, and classroom behaviors among children, and it associated with low level of stress and anxiety, and it can improve standardized test scores. As example, according to the Carlson in 2008, he found that small but significant benefits having physical education to academic achievements. He done a study in 2008. He found that there is a positive relationship between physical education and academic achievements. And according to the Bob and Quick in 2016, family environment may be considered in the developing of the physical activity interventions and policies. These are our objectives: to assess the parents' knowledge, attitude, and practices about LDP of the children aged 9 years old in Kesbewa Education Division, and determine the association of LDP of the children with educational, economical, and social factors of the family. And study design was descriptive cross-sectional study. In Kesbewa Education Division, there are 26 schools. Was in there, and our population was school children aged 9 years old and their parents. So we use stratified random sampling as a sample technique, and our sample size was 413 school children and their parents, but participated sample size was 342. And we use SPSS version 23 for the data analysis. Our inclusion criteria were male and female school age children aged 9 years in Kesbewa Education Division, and parents who having children 9 years of age. And our exclusion criteria were children with any physical disease or any special needs, and parents who were illiterate. And there are 2 pre-tests, and then after that we administered pre-made questionnaire for the children and their parents. The children questionnaire included that we measured physical activity level with the questionnaire according to the Gordon physical activity scale, and parents questionnaire included that socio-demographic data, knowledge, attitude, and practices on LTPA. These are the result as a demographic data. Most of participations are mothers, and we have about the marital state. We had widowed, divorced, and married family. Majority of them married. And the educational state, most of them are educated up to A level, and most of them having a 25,000 to 35,000 rupees monthly income. And this is the result and physical activity of the children. We measured it using four categories: active, moderate active, inactive, and high active. Majority of them active and in moderate and active category, and inactive percentage was 7. This is our assessment of knowledge. We used 5 questions for the assess the knowledge about the heard about LDPA and its influence human body and mind. Obesity reduced by LDPA. Its influence of education and competition and cultural effect influence to the LDPA. Both of parents having a good knowledge about that as a result. This is about the attitude. We use 3 questions: only needed school activities, only needed LDPA, and so school activity and LDPA both are needed equally. Majority of them accept that school activities and LDPA both are needed. And this is about the barriers for the physical activity of the children according to their parents. We gave 7 barriers: no supervised when children playing, no colleagues to play, road crossing, not enough space, not enough experience, traffic jam and unsafety state, not road crossing and not enough space to play, and traffic jam, unsafety street. Lot of mothers agree with that, and no supervised when children playing and no colleagues to play. Both of them are rejected. And this is the association about the education level, economical state, and marital state. We found an association with marital state. Both married family having a parents, children with good physical activity level. And this is our discussion. The study found that 97.6% parents had heard about the LDPA. Almost all of them believe that LDPA improve not only the child physical activities, mental state also. When considering the attributes, 70.4 parents in opinion of children must participate both academic and physical activities, and 97% for guardian engaged in LDPA according to the study. And according to the OLI and 2018, they found that half of the mother had good knowledge and attitudes, and most of them had poor practices in Nepal. And according to Alexander in 2006, he found that high cost, poor access to facilities, and unsafe environment are barriers to the participation of the sports and physical activity in UK children. And this is the conclusion. The conclusion was we found that most of times parents are aware about this important aspect. And these are our references, and I want to acknowledge all the participants of the study and our supervisors.
Thank you very much, and also for keeping time. We have some time for questions. Go ahead.
Yeah, thank you very much for your presentation. Why did you choose this 9 years old school children?
Sir, because they have scholarship exam, grade 5 scholarship exam having because they have not enough time to physical activities. They have not enough time. That's the reason.
So, did you include all 26 schools in your study?
No, not all 26 schools. We choose 5 schools.
How did you choose?
Study by kind of sampling method. No, we choose that there are 4 types of school in that area. In 26 schools, there are 4 types. We chose participated all type of school.
Any other questions?
Yes, sir. We got. No, sir. We have a family divorced, widowed, and married family. No? Married relationship means married family, sir. Not widowed and divorced family. Yes, sir.
Okay.
Okay.